Good morning. Thank you all for coming to this breakout session on economic empowerment and adolescent health. And I just wanted to, real quick, thank all of our speakers for agreeing to present here. And I want to thank the School of Social Service Administration for allowing me to moderate this panel. I'm a student here, and I'm very interested in topics of vulnerable adolescents and in global initiatives. So we'll begin down here with Leyla Ismayilova. She's a professor here at SSA. She received her doctoral and master's degrees from Columbia University, and she now works with development and adaptation of health promotion and family-based interventions in the international context. She's worked in Sub-Saharan Africa, the Middle East, and the former Soviet Union. She focuses on developing culturally congruent interventions to improve mental health functioning and reduce behaviors, sexual risk behaviors and substance abuse among children and at-risk youth. Sitting next to her is Tonbofa Ashimi. She received her LLB degree from the University of Lagos, Nigeria, and her Master's of Law from Harvard Law School. She is now a managing partner at her law firm, but she was the Director General of Due Process and E-Governance Bureau of Bayelsa State Government, Special Advisor to Bayelsa State Government of Trade, Coordinator of the Bayelsa State Government Child Development Account Pilot Project, which uses the Subi Uganda projects model, and that was initiated by Columbia University, so she's very familiar with Fred. Directly next to her is Sanyukta Mathur, and Sanyukta received her PhD in Public Health and Social Medical Sciences from Columbia University. Her master's degree in Health Science is from Johns Hopkins, and her research interests include adolescent reproductive health, HIV/AIDS, youth livelihoods, and social transitions. She's the project director and investigator of 2 research projects that explore research factors of HIV incident infections among youth and examine the intersection between reproductive health desires and HIV risk. Before coming to Columbia University, Mathur worked with the International Center for Research on Women as a public health specialist. And last but not least, Njeri Kagotho earned her doctoral and master's degree from Washington University in St. Louis. She is deeply influenced by her international practice, and her research explores the link between a family's wealth holdings and the well-being of its members. Her research has focused on the impact of chronic illness on wealth concentration and preservation, how wealth moderates health behaviors and impacts of HIV/AIDS on the intergenerational transmission of human capital. So won't you please join me in welcoming this great panel.
I will be talking about a project that we're starting in Burkina Faso, looking at child protective outcomes among ultra-poor families. And it was hard for people to present the work that they have done over several years in 15 minutes. We haven't even started yet, so it's just and it's still hard to do it in 10 or 15 minutes. So I'll try my best. So I'll probably just briefly outline some of the core components of the project, and we'll try to get to the last slide that focuses on the challenges, and I think that's kind of the main purpose of the calendar. I was really talking about the research and conceptual challenges we have in implementing studies that are trying to incorporate economic empowerment interventions. Very briefly, so similar to this conference, this project is a collaboration of academic partners from the University of Chicago, 2 NGOs that are working in the field in Burkina Faso. It's Trickle Up in Adelphi, 2 partners in New York, and obviously the funding organization. Slightly different population. So this project is focusing not only in a different country, so it's not in East Africa as the previous projects are focusing. This one is taking a similar idea but to West African country of Burkina Faso. And it is also slightly a different population. So the idea was to figure out if economic empowerment can also have outcomes on child protective variables. And I'll explain what I mean by child protection, but one of the key variables we were interested in looking at children who are working. And globally, we currently have about 100 and almost 90 million of kids who are between the ages 5 to 14 who are involved in child labor. UNICEF defines child labor as kids who spend more than 28 hours on household work, or kids who are between 5 to 11 who are just working even at least 1 hour a week who are involved in economic activities, and kids who are between 12 to 14 who spend more than 14 hours a week on work. Even though globally, we read, ILO reports, they're saying there is a drastic decrease in the number of child laborers in the world, from about 250 million to 170 million. But at the same time, I think we have to look at these numbers a little bit skeptically, because what also happened during that time is the definition of the child labor has changed slightly. So before it was also including kids who were 15 to 17 adolescents, and now they're mainly focusing on children who are under the 14. Because on one hand, this could be a good news. On the other hand, we could think of, did we really find solutions that helped us drop the number almost by the third? And the questions we are really not sure. And I think that's kind of was the purpose of this study, to really test to see that can we use some of the economic empowerment interventions as a way of working with this issue. So globally, in terms of absolute numbers, obviously the largest number of kids who are in labor force are in the Asian and Pacific region. But the largest prevalence still remains in Sub-Saharan Africa. So on average, it's about 22% of the child's populations who are involved in child labor. But in Burkina Faso specifically, being as among the least least developed countries, the percentage is it's almost like a third, over a third of the child's population are involved in child labor, right? So it's 39%. And in addition to many other factors, such as poverty and a lot of structural factors, what makes it difficult in Burkina Faso, it's ongoing problems with food and nutrition, mainly due to location, right? Especially the north of the country covering the Sahel desert is really kind of contributing to this ongoing food and nutrition crisis. And you will see that this theme will keep coming up. And Professor Julie Hanley, she mentioned earlier that it was surprising to see the issue of food, that we often don't really think so much of when we talk about health in this country or even many other parts of the world, that you will see that it will keep coming up. And it's something that we don't often take into account when we look at health outcomes for kids. So specifically, I won't spend too much time, but just to give you an idea of what child labor in Burkina Faso looks like, most of them, of course, are involved in family businesses, so really helping their parents or grandparents with simple things, trading fruits, helping in the garden, tending animals. But there are also more severe situations when kids are involved in working in gold mines, in cotton fields, in chocolate factories, and sometimes they're they go there with their families, but sometimes they are trafficked. And usually kids who live in families that are struggling financially, they're the ones who are at the highest risk. So that's kind of why we came up with this idea to evaluate, to see that whether economic empowerment intervention can have a protective factor and can prevent kids from working and being exploited, because once kids are working, very often they end up being exploited, especially if they're away from their parents. And lots of the violence that they're exposed comes through their employment. But my father is a mathematician, and he always thinks about concepts as necessary and sufficient. So these are two kind of important approaches, I think, that I was trying to apply to this work, because it seems that economic empowerment interventions, especially in low resource settings, are becoming or viewed as a necessary condition. But I think what we are also trying to answer in this study is it a sufficient condition to answer some of the questions or to improve child protective outcomes or health outcomes? And that's why, in addition to looking at the one arm that would look specifically at the economic interventions, we were wondering if we could look at combined intervention that would introduce this child rights intervention in addition to the economic. So the first one is trying to figure out if economic household strengthening program has any protective outcomes. But the second arm of our study will look if the combined intervention will have any additive effects. Okay, just three kind of broad areas of outcomes: the child labor, everything from whether kids are working or not, whether they're working under hazardous conditions, and whether they're involved in the worst forms of child labor. That includes slavery, debt bondage, so when kids are sometimes given to another person or household to pay debts, so they can work on someone else's farm if the family is owning something. So by being exposed to work, kids are often, either exploited, or could be exposed to violence, and not only physical violence, but also sexual violence. For example, if girls, in particular, who are working in someone else's household as a maid, they're usually not high risk for abuse, and that obviously causes many other issues as well, like just kids can stop going to school because they're just working so much in their own household. Kids can be involved in sex work and forced in early marriage. And on one hand, you would think, like, what does that have to do with poverty? Maybe not here when we look at, child or kind of early pregnancies. That would be a very different approach. When we look at low-income settings, by giving away a girl to another family, you're reducing the economic burden on the family. So, and these decisions are often not made by the girls themselves, they're made by the families. So therefore, the traditional kind of more sex education programs may not be necessarily most important here. We also have to take into account the economic component. So as I mentioned, just kind of the two underlying assumptions that we want to test in this study. First, is it the extreme poverty that is linked to this issue, or is it the cultural norms and the lack of information about the risks that are associated with being employed that are affecting it? And these are the two programs that are implemented by two partners in the field. The Trickle Ups primarily does economic intervention, and it is slightly different from child savings accounts that are used in SUBI. These are savings groups, and this also intervention has seed grants. So basically, families, in particular female caregivers, receiving the money, and then together they're having kind of monthly meetings, and then they decide how the money would be spent, and they receive also some information on how to budget, but a separate component that focuses specifically on different cultural norms associated with raising kids, with sending them to school, with marrying kids, especially girls. So that one is targeted by another organization. So this is just to give you an idea of where the study is going to take place, because that will that kind of informs why we were having so many challenges with trying to figure out how to measure some of the things. So I'll probably skip some of these things because these are just details. I can go over them later if you have any questions. But the main idea is that we were looking at the households, and I'll get to the idea that household seems a very easy term, but turned out to be extremely, extremely complicated once we got to the field, because when you have large families or living all together and having very complex structures, so how do you measure the effect of your economic intervention, and who do you intervene, and how do you select? So leaving all that aside, because these are more kind of a technical issues, one that I wanted just to point out, that something that was really challenging for our IRB is that we had to request not only typical permission for the mom to consent for the child, but we also had to request the father, the head of the household, who had to give a permission for the mother and the child to participate. So this was just kind of another factor showing how different it is when we start intervening in some of the cultural settings that are slightly different. This is just, the structure of our study. We have three three groups, two of them the interventions. One is the Trickle Up economic, the Trickle Up plus, it's the combined intervention. We're comparing to the waste list condition. Let me just get to the last point here, because that's what I was primarily wanted to emphasize. So given the complex structure of the household, it really causes a lot of problems in creating the measurement instruments. And measurement instruments, we all struggle with that, because a lot of the things that are measuring depression, well-being, stress, of course, many of them were designed outside of this. So we do know all those challenges, kind of adapting them to a different cultural environment. But on the top of that, it's also hard to adapt it to the environments where the family structures are completely different when you don't have just one mother, or you would have one mother, but there are also 3 other wives of your father who are living in that environment. So when we talk about children that we will be selecting into the study, and then how the money is spent on these children, and because these are not clearly defined boundaries, you kind of all live together. So when we were even asking, what's the size of your household? The question would be, what do you consider a household? We say, okay, people you live under one roof. You don't live even with your parents even sometimes under your roof because they're very small houses, right? And they're all together. So how do you measure all those things? It was really challenging. Another big issue is literacy, because even simple questions as age, people just wouldn't know age because most of the mothers never went to school. So, and that's even just as simple as age. When we talk about time-bound variables, we used to measure things, okay, over the past year, what change has occurred? Or how many hours did your child work in the last week? So things like that, very standard measures, kind of what seems to us very clear indicators, are really hard to get from people who are illiterate. And not only illiterate, so I'm talking about the language. So we had to have multiple translations. We know that it's always difficult to translate instruments. But imagine translating it not only from English to French, which is the national, kind of the official language of the country, but people in these villages or in this region, they don't speak French, so they speak local language, Mure, and they're illiterate, so they don't read and write. But the data collectors that we had, they all went to universities, so they're obviously educated, right? They speak Mure colloquially at home, but they don't read and write in Mure. So how do you introduce the idea of collecting data accurately and consistently even when you translate an instrument, your interviewer cannot even read that instrument, right? But they can talk to the participant. So all these issues kind of caused us a lot of problems, and I hope that we will hear from other presenters as well to see how all of you are addressing and trying to implement some of the concepts that exist into the field and kind of more applicable research. So yeah, I can. You want me to?
Good morning, everyone. So my name is Tonbofa Ashimi, and I was the coordinator of the Bayelsa State Child Development Account Project. This was meant to be a pilot project to run for 3 years, but it got prematurely stopped. And I guess as we move on, we'll understand why. So this project was the Child Development Account Project, and we tried to, give it its own special name. So we called it Saving, Training, and Rewarding Savers, acronym STARS. So we would call them, we called the participants CDA STARS. So that's the logo we came up with. And then on the left is the Bayelsa State Government emblem. Bayelsa, okay, just a little bit about Bayelsa State so you would understand why the state government at that time decided that this project should be implemented there. It's located in Nigeria's Niger Delta region. That's the southern part of Nigeria that is responsible for most of the oil production in Nigeria and has one of the largest oil and gas reserves. So of course, it suffers the consequences of the resource course, constant pollution, endemic poverty. The residents are primarily fishermen, about 2 million people. Yes, poverty, pollution, criminal activities, we've been experiencing a constant rise in militant criminal activities, oil bunkering, kidnapping of oil expatriates, companies, expatriates, and of course, political violence, ethnic violence, all as a result of trying to control the oil or trying to benefit from the oil revenue, which really is controlled nationally. The state governments really have no control on oil or its revenue, but the residents of the states have not been able to understand why they are living in so much poverty. despite them seeing the oil being taken from their ground, just like in many other oil-producing states. So this resulted in, at one point, just between 2006 to 2009, the criminal activities were so high that the oil companies couldn't even access. They couldn't access their reserves. They couldn't explore the oil they were required to. And of course, the nation's revenue was dwindling. And so the president in 2009 decided to grant amnesty to all the militants that were involved in the criminal activities. They had different militant groups from the men, they all gave themselves different names, who were involved in oil bunkering, kidnapping of expatriates. And no one was going to the state. The president didn't know how to, if you would see some pictures where most of the oil is located in the creeks. Nobody can access the creeks. But the people of the residents, the indigents, know their creeks. So, of course, none of the military men could go there to do anything. The president had to come up with a resolution. He had to negotiate with them. And so amnesty was granted to every militant that had been involved in the criminal activities in 2009. And, of course, many people thought it was a great offer because the amnesty program came up with education, vocational activities, training abroad for the militants. So a number of them came forward. They dropped their arms. And so this is a collection of some of the militants. And you will see that they are primarily young men. It was the youth of the state that were involved in these activities. And so the government at that time decided that, try to ascertain the cause for militant behavior. And so when it was approached by Fred and his team, the government decided that, look, they should look beyond the amnesty and go to the cause for the militant behavior and try and prevent this from recurring. And so they embraced the program, the Child Development Account Program, and agreed to commence with a pilot, which was launched in 2010. And the partners were the Columbia University, World Bank, New American Foundation, and Links Nigeria were the partners. The schools that were selected to participate in this program were selected randomly from Columbia University. And there are 8 local government areas in Bayelsa State, so 3 schools from each local government were selected. And these were really remote communities that were randomly selected, which was good because usually government projects, are left in the hands of the civil servants, and they select their communities, And so there's so many communities that hadn't benefited from government programs. So the random selection done by people who were so far away resulted in picking communities that really were surprised to have been selected. The project team, that was myself, and we had a team of about 2 civil servants and 2 students that were part of the team. And we selected the students that would perform from each of these schools. And it was selected randomly based on the exam performance from some of the annual exams they performed in GS1, GS2, which is like a grade 8, grade 9 in the US. The students were between 12 to 13 years. These were students who, their parents were fishermen. They had never left their villages. These villages were so remote that, even to access the village was a huge problem for us. But they had dreams. They wanted to be doctors, engineers. Funny enough, none of them wanted to be fishermen, meaning that they all wanted to run away from their villages. Or perhaps they just didn't see fishermen as fishing as something that would give them the kind of economic, the wealth they thought that they should have. But they did have dreams. Okay, so I thought perhaps I should allow you to understand where we had to go to. So this is a view of the community based on it was on an island and could only be accessed by boat. So you can see the huts and vegetation everywhere, even where their huts were built. And this is us, very 007-ish. No jetty, no anchor, climbing off the boat. That is me in the skirt. And you wonder, why was I wearing a skirt? A principal in one of the schools said to me, "Oh, madam, I'm very glad that you are dressed appropriately. If you were wearing trousers, I wouldn't have spoken to you." And I just thought, my goodness, where are you? Where do you live, you know? But so we had to dress in our skirts, very uncomfortable, climb the boat, jump off onto the sand. So that was how difficult it was to access these communities. But we did go. So this is us entering one of the communities. That's the project team. This is they are just a little pathway leading to the school. And so these are the parents of some of, we call them the CDA stars. So we would go to the communities, we would meet with the students, and then we would invite their parents, because we believe that, I mean, the project could not be successful if the parents didn't buy into it. And so this is the students, we would give them survey forms to measure their state of mind at the commencement of the project. Fill in the blank forms. Then this is a picture of the students and the team. And just to understand what the project really was, it was, we opened savings accounts for the students. A bank was selected. Many banks put in their bid, but we selected a bank in Nigeria, and we opened savings accounts for the students. In the savings account, the government was the sole funder of the project. And the government was to put in a seed capital of 40,000 naira, equivalent of $235 and the students were to save into these accounts. And the whole idea is, should the students actually save in their accounts, the government would match the saved funds periodically. And the students would only access the funds, their funds and the government fund, after graduating from secondary school. And so the project also had a financial training aspect. It was like an after-school club to train the students on how to save, importance of savings. And it was coordinated by Links Nigeria, which is a non-governmental organization in Nigeria. And then they trained 2 teachers from each school who ran the clubs. There was a lot of excitement. The parents were excited. The children were excited. And we actually got, once the project started, the students actually saved, you know. With the first quarter, they saved the equivalent of $894. And this was big, considering that these are parents are fishermen, really have no income. So we were very excited about. We had the inter-school soccer competition just to encourage the morale, and everyone was happy. The participation was good in the after-school club. Participation was very high. But the project was not without its challenges. The first was that the government just refused, or perhaps I shouldn't say refused, could not put in its own seed money. So we had started the project. We managed to get the project implementation funds, but the government did not put in its seed money. Then there's something that we all, you know, try to avoid in whatever we do in developing countries, which is the political risk. Should there be a change of government, would the project continue? In this case, no, we did not, because the incoming government decided that he didn't want to continue with the project. So there we were, a project that had started out well, students were excited, but the government wasn't ready to continue. The project had to come to an end, sadly. Measuring of the participation, I mean, we couldn't verify it because the after-school club teachers, they would give us their reports, but I mean, I didn't think most of those reports were actually true. And then, of course, distance amongst the communities was also a problem. And then we couldn't carry out any periodic surveys after the initial survey, so there was no way we could measure. Well, just a few recommendations for next time for, I mean, all of you here. If a project is to be wholly sponsored by the government, please collect the seed fund immediately. Please, because there you go in raising the hopes of little children, and then you dash it. And then you damage the little trust that they have gotten back in their government. Try and let's keep the distance amongst the schools. Let the distance not be much. And then we should ensure independence to ensure project continuity. Thank you.
Good morning. I think it's still good morning. My name is Sanyukta Mathur, and as Sarah's already introduced me, but I feel like since everybody started with a little confessional about their orientation, this morning I should do the same. I come from an international development background with a strong emphasis on gender analysis, and then I'm a public health social scientist by training. And I'm actually, I think, maybe different on this panel because I'm not talking about a specific program, but actually about some work I did some time ago when I was with the International Center for Research on Women, where we looked at programs that are linking livelihoods and reproductive health interventions for adolescents. So it was both a desk review and then an in-depth review in 3 countries. And I will say very openly, the work is pretty old. It's now been, it was a decade ago. And I came to this conference really wanting, because, philosophers say you do things repeatedly in your life. I feel like I'm come full circle. And for me, the work on adolescence and health and livelihoods is coming together again. So I'm very excited to be here at this conference because a lot of the things we've already heard on this panel about issues related to measurement or government engagement were some of the same issues that we were finding were the challenges with linked programs a decade ago when we did this review. And so I would really love it if, as a panel and as an audience, if we could engage in what this means for the future of these kind of integrated or linked programs. There's a lot of different terminologies used, but I think that would also be really interesting to discuss. So with that sort of confessional, I already said who I am. And I think maybe the best way to start out with is actually a little story. And this is a story most recently from the work that I'm doing with Dr. John Santelli and with the Rakai Health Sciences Program in Uganda. This is a young man. He's 23 years old. He dropped out of secondary school because of lack of money for school fees. He had wanted to be a teacher. He is very concerned about creating a separate household for himself, and so he travels back and forth from Kampala for factory work, but hasn't been able to find any permanent employment. When he was younger, he wanted to have a monogamous relationship with someone he could trust, a trustworthy partner, and he says, I didn't want to get someone to stay with at home. I wanted someone to stay with at home, not multiple partners, not practice promiscuity. His own mother had died of HIV/AIDS, and so he wanted to really avoid HIV. But in trying to get that marital partner, he had unprotected sex so that they could have a child together to really cement that relationship. Ultimately, because of his economic insecurity, he couldn't take care of that partner, and the girl's parents forced him to separate from her. He found out sadly, and he disclosed to our interviewers that he was HIV positive when he last returned from Kampala. He is not yet on treatment. He's afraid to access treatment for many of the reasons we heard in the session earlier this morning. And he also disclosed to us that he has a lot of current casual partnerships. He reports inconsistent condom use, again, because of his continuing aspirations for partnership formation and family life. I think we can see from that case study and many others that you all probably know very intimately that youth health and well-being are so intimately related. Issues around early pregnancy and STDs, not only are they influenced by access to education, but the arrows work the other way also. So when people drop out of school, or if they have a child too early, they enter into the labor force under conditions that might be putting them at greater risk. So adolescents who don't have educational access might be entering the labor force in more marginalized situations or engage in sex work, for example. Sorry, I keep pressing the wrong button here. And we've been talking about the language here has really been around family economic interventions, but I think the other term that's been used a lot in international development is this language of structural interventions, that it comes up in public health literature as well. And we are talking about number 6, which is economic interventions, but I think it's important to think about that whenever we are doing economic interventions in countries, there are also other aspects of those interventions. Policy level changes, we're looking at different environments that enable those kinds of structures. So Fred Ssewamala talks about working with banks to really provide an infrastructure for banking for adolescents that are traditionally excluded from it. We're also talking about changing social norms. In some places, we're talking about political change, as we just heard in Nigeria, and sometimes not always successfully. And there's the empowerment of communities and groups. They're part of the economic intervention, but they're also separate from it because they require specific activities and emphases. So now let me go to the way back work that we did. And at that point, and I think we're still a little bit there, is why reproductive health and livelihood should be linked was a little clearer than how best to link these two interventions. And if you think historically, in countries like the East Asian tigers, like in Taiwan, larger social and economic development created changes in fertility rates and stuff. So there were national level structural changes. What we are often faced with now is sort of filling the gap, civil society organizations that are filling the gap where larger national systems haven't yet come to fruition or are not interested in it. And so what that has often led to some level of design, intuition, and experimentation, often limited resources and skill sets to document or evaluate the impact of these programs, and the emergence of these kind of linkages from different sectoral approaches, which I think leads to some of the confusion about whether these programs work or not. It depends on who you ask and how they implemented it. So this is a report that's available still on the ICRW website. We did 2 levels of work. First was an inventory of all programs at that point that were conducting linked programs. And so all the fantastic programs you've been hearing about today were not in existence then, so they're not captured here. And then we selected one country in Latin America, one in Sub-Saharan Africa, and one in South Asia, because we wanted to drill down into specific issues that were more context-oriented. So Kenya we picked because of the issue of HIV orphans and HIV/AIDS that was really emerging at that time. In India because of gender inequity, and in Colombia because there was a very strong context of post-conflict and youth violence. I'm going to try and go through this more rapidly because I think I'm getting to my time. One of the first findings really was how these kinds of linked programs emerged. And there were 2 types of organizations largely. One was sector-specific organizations, and the others are multi-service, community-based organizations. So a sector-specific organization is an organization that is implementing, let's say, a family planning program and realizes that really people are not coming to those family planning services because there's a transport issue or there's a cost issue, and they will maybe do a referral or some sort of add-on, economic intervention. Multi-service organizations were generally community-based civil service organizations that had a much more development and human development perspective that provided different needs for communities. And what we found actually were that of the 239 programs that we had in our initial inventory, only 16% at that time were really fitting these top two criteria in the multi-service organizations on the top left, where these dual services were being provided to one target group, and there was an idea to connect health and economic interventions from the design stage, or that even though the component had been added on, there had been a real conceptualization of how these two things connect for adolescents. So what were some of the characteristics that were common across these linked programs? So if you look at program-related characteristics, I think one of the most exciting things for us was that they were grassroots and demand-driven. At that point, there was great donor interest in adolescent programming, and like I said, things come around in a circle. I feel like we're on an upswing again, which is great. But what was nice is that these programs weren't necessarily donor-driven. They were because there was demand from participants themselves, from beneficiaries, and from the communities. At the same time, we felt there were very few model link programs because people worked, and because of that, they achieved marginal success in that linkage and in achieving their desired outcome. And I'll talk a little bit about that if I have time. And I think the biggest challenge for us still is the lack of consistent, high quality, and reliable assessment data in these programs. There were some organization-related characteristics that were really important to link programs. And one was the dedicated and charismatic leadership that really allowed some of these programs to happen. And we can maybe call Fred Ssewamala the charismatic leadership. And this was both positive and negative because a lot of the organizations did not have a second-tier manager who would continue or would be able to continue the vision of some of these leaders if they moved on to other endeavors. And so what is the real sustainability of these community-based initiatives? I think we can talk, and then some of the client-related characteristics or participant characteristics, I think it was fantastic. Most of the programs focused on poor and marginalized communities, but the focus was oftentimes on young women and a very limited focus on young men. Some of the programs that worked on adolescent violence particularly looked at young men, but very few others actively recruited young men into the program. So we had a set of 6 recommendations, and I'm going to just skip through, and I think what I want to talk, just end with, is how we move forward, or rather, these are questions that I have in my mind, and I'm hoping we can engage in some discussion about. I think in moving forward with these types of interventions, we do need to think about the scope and the level at which the intervention is attempting to work. Are we looking at group or individual level behavior change, or are we trying to address broader systems and structures that enable individuals or shape distal factors? So I have up here the framework that John Santelli had briefly flashed up. This is a project I work with him on in Uganda. And so if we're working at individual level behavior change, then different types of interventions are needed than if we're trying to change the way HIV policy or school policy is implemented then in Uganda. I think the second big question that remains in our field, and it's touchy depending on what donor interests are, is what is then our method for assessing social or structural interventions? Randomized control trials are the holy grail, and some really interesting work is happening here that you've heard about today. The assumption, though, with randomized control trials, is that there is a cause and effect relationship, and that the assumption is that there's some universal mechanism by which they operate. However, in these types of interventions, we're actually trying to affect social change at some point, and social change is nothing else, but if nothing else, messy and not universal. So how does that affect the way these types of interventions are run? Doesn't context matter? Doesn't it actually shape the way these interventions work? And how do we take those into account in terms of our research design? And are there alternatives to randomized control trials that are still rigorous, that show the evidence for these kind of complicated interventions? And I think finally, we need to think a little bit about gendered vulnerabilities. So there has been, I think, greater examination of how gendered power dynamics within sexual relationships, and put women at risk. Have we thought as much? Have we given the same amount of attention to how social and structural factors are shaping HIV risk and vulnerabilities and reproductive health vulnerabilities for young men? How do young men's expectations about masculine roles and responsibilities, their pressure to demonstrate masculine behaviors in various contexts, and expectations, experiences, or desires for fatherhood, how are they putting them at risk? And how do we give greater attention to them as well? So I will end here and hopefully leave room for lots of discussion.
So my name is Njeri Kagotho, and I am at Adelphi. And I'm like every other person who's here from New York. I will not apologize for speaking fast. And I think we can get this done in under 15 minutes. So my topic today is asset retention for the most vulnerable. What can we learn from asset-based interventions? When I talk about asset retention, I am talking about an individual's ability to have full control over their assets, over their property, over their wealth. And when I talk about asset-based interventions, I am referencing. You can't hear me? Oh wow, that's the loudest I've ever been. When I speak about asset-based interventions, I am actually referencing the work of Dr. Sheridan and IDAs, the individual development accounts. We've heard today they've been called CDAs, we call them CSAs, we call them WSAs for women savings accounts. So that's the kind of work I'm referencing. So what can we learn from these interventions when it comes to helping our clients who either don't qualify for those asset-based interventions or don't really need to be in them, hold on to the wealth that they've already accumulated? No? What did I just do? Okay. So what I'm going to look at today, who are the most vulnerable? What are the barriers to asset retention? Then going over back to asset-based interventions, is there evidence that at the conclusion of asset-based interventions, our clients can actually hold on and maintain their wealth? What works? How does it work? Can we adapt it to other vulnerable populations? Okay. So maybe I start with a narrative of how I got to where I am. It all started in 2010. I got funding from the Center for Social Development at Washington University to go to Kenya. And I was very interested in parenting practices for parents and caregivers who'd received a HIV diagnosis. And I went to Kenya, interviewed child-parent dyads, interviewed a few key informants. And what came out of those interventions is that parents are concerned about continuity of care for their children. So what happens to their children after they are unable to provide care for them or no longer alive to provide care for them? And parents were especially concerned about securing their children's education. And I came back to New York, analyzed the data, and as you all know about qualitative data, there's another gap in question. Now, I realized that none of my respondents actually talked about the processes or the mechanisms that they were engaged in to secure continuity of care for their children. So off I went back to Kenya in 2012, this time applying a phenomenological approach, interviewing only parents and caregivers this time who had received a HIV seropositive diagnosis, and trying to look at those mechanisms. So what do you do and how do you go about that? And from that data, one of the most important findings was that in as much as they just had a little amount of wealth, they were very concerned about maintaining, retaining that wealth, and then passing it on to their children. Hence the intergenerational transfer of wealth that I'm really interested in. And at the end of those interviews, my respondents would ask me, so Mwalimu, what's next? You know, so how do we go about making sure that our mothers-in-law don't divest us because we're HIV positive? How do we go about making sure that we don't run into a financial intermediary that's full of con people and they take all our savings away? How do we make sure that the little money we are accumulating as an informal group actually remains within the group and then trickles down to our children? And that's what I have to ask you today. Truth in advertising, I have more questions than I have answers, and I'm actually hoping that I can get to hear back from a few of you. So why does securing family assets matter? I think we've heard it ad nauseum all day why it matters. Economic stability, improved physical, mental health outcomes, behavioral change, and equity among family members, especially when you think about the intergenerational inter- and intra-generational transmission of wealth, what many of us call inheritance. It's also called succession, that it establishes equity among family members. So, this is what I want you to remember, that unlike developed nations, weak and misaligned institutions in Sub-Saharan Africa make the retention of household assets difficult. So hold on to that thought, right, as we walk through the rest of the presentation. So what does the literature tell us about the barriers to wealth retention in Sub-Saharan Africa? Cost prohibitive formal institutions, right? So we're talking it's difficult to access strong financial intermediaries such as banks and credit unions. It's difficult to access that lawyer, a burdensome and complex process, bias in informal institutions, and a misalignment between the formal and the informal institutions. So let me give you an example. So in Kenya, we have, and I must say this, that over the years, especially since 2005, that in SSA, that our governments have made a concerted effort to make sure that they strengthen the formal institutions. So talking about issues of governance and trying to make sure that we implement laws and rules and kind of rewrite our constitutions so that we have equality in our country, so that we are protecting the most vulnerable. So I will just put that out there. But we also have informal rules, right? Customary rules. So when you talk about children living in a household with 4 mothers, that is nothing strange to me, right? Because I do know you can have 4 moms, right? But what does that mean if you're the child of the second wife and the head of household dies, and it comes time to divvying up the property wealth? Who gets what, right? What does it mean if you're a daughter in such a homestead and your father takes to dividing up the wealth? Who gets what, right? So for instance, when we look at Kenya, our succession laws, we have the 1972 Succession Act. It's meant to harmonize. We have about 40 tribes, all doing their own thing, right? So we have this succession law that's aimed at harmonizing all those 40 cultural practices, right? But it's difficult to get hold of a lawyer, right? So we're still doing a lot of things informally, and when we do that, we have vulnerable groups that actually lose out on wealth. So when you look at the groups that are most vulnerable to asset loss, the poor, people living with HIV, women, children, people living with a disability, the one thing they all have in common is they're socially excluded, right? So they're excluded from our social, economic, and political institutions, right? So that's the one thing that ties them all together. But when we look at them, some of them are, and I call these subgroups, a little bit more vulnerable than the rest. So when I talked about my 2012 data, the phenomenological study, what we found is that there is a subgroup that's especially vulnerable to losing property. We're talking about if you have a HIV diagnosis, you're female, and you're poor, it becomes really hard to hold on to your family wealth. So we've heard a lot about children today, child-headed households, and what happens when you're a single, double orphaned, right? And your uncles come in and take everything away, and you're left on the streets, right? So parents were then concerned, how do I make sure that the goat I have, right, devolves down to my children after I pass away? I actually had a respondent say that I have some property somewhere, but I've never told my brothers about it. Because I know once I die, they will go and claim that for themselves. So what she had done was that she had taken her children individually to show them where her little pieces of land were, for fear that her relatives, after she passed on, would divest her children. So I have, I think, 3 minutes. So that's a problem, right? And remember what I told you about the weak and misaligned institutions, the formal and informal institutions in Africa. And so it brought me back to looking at these asset-based interventions. So we've been doing this, I think, now for more than 20 years, 25 years, IDAs, right? And I asked myself, after our participants graduate, can they retain that wealth? And if they can, what is it that's inherent in these programs that we can then purse out and adapt to populations that are not enrolled in an IDA, right? So looking at the data, we know, and this is US data, I have to say, that participants retain assets after graduation, they continue to accumulate assets, and my very favorite one is that they work on cleaning up their credit, right? So we do know IDAs work, that after you graduate, you're still able to continue saving. So what is it we're doing and how does it work? I don't know. I honestly don't know, and I guess that's the next step in my research. But just looking at the literature and looking at what has come out of Sub-Saharan Africa, some of the key words, the key components of most of these interventions